Welcome to the Elder Care Committee for October 28, 2019. Has everyone had a chance to look at the minutes of the previous meeting?
Make a motion.
Second.
All in favor?
Aye.
Motion carries. The first, we're going to lump the first three items together because they're all concerning congregate meals. So, Commissioner Raytano?
We are here, thank you.
I'm sorry.
Oh.
We need a motion to group these.
Motion.
In the second, and all in favor?
Aye.
So that carries. Commissioner, good
Okay.
evening.
Thank you, Mr. Chair. We're here to ask for, just to have these contracts renewed. And the contracts are for the congregate meal service for Life Path, for Colony Senior Services, and for projects of Ravina. And there are three congregate sites. I mean, there's more than three congregate sites, but those are the three providers.
Three contracts, yes. Any questions?
Motion.
There's a motion, a second. All in favor? Aye. That motion carries. I'd like a motion to group numbers 4, 5, and 6 that are all regarding home-delivered meals. Motion second. All in favor?
Aye.
Commissioner?
We are asking you to please renew the contracts for our home-delivered meals that are provided by Life Path, formerly Senior Services of Albany, projects of Ravina, Peter Young Industries, and I think that's all of them.
So,
There's not four, there's three.
are there any
Yeah.
questions? Or a motion? A second. All in favor?
Aye.
That carries, thank you. And Commissioner, finally, number 7, authorizing an agreement with Life Path regarding adult day services for seniors.
Yes, we were asking also that you would renew this contract for adult daycare, and it's provided by Life Path, which is formerly Senior Services of Albany.
Any questions? There's a motion and a second. All in favor?
Aye.
Aye. That motion carries. Thank you. Number 8 is also, Commissioner?
Yep, this is for transportation with CDTA, and we're also asking that there be a renewal of this contract. It's Access Transit, Inc., and it's with CDTA.
Who uses that transportation? Is that open for everybody in town?
Oh, yes, everybody in the county, yeah.
Any other questions?
Any area particularly uses more than others?
You know, I'd have to check because I'm not really quite sure about that because CDTA gets the money and then they subcontract out. So I'm really not sure which areas. I know that certainly a lot in the city gets used. Colony uses it. Hilltowns.
Thank you.
Okay.
Motion.
Motion and a second. All in favor?
Aye.
That motion carries. Thank you. Thank you, Commissioner.
Thank you very much.
Mr. Slatkin?
I hope you're as lumpy as I am.
Good evening. We have item number 9, authorizing the agreement with Century Linen.
Good evening. Thanks for having me to go over our contracts for Shaker Place Rehabilitation and Nursing Center. This first contract is for a 36-month, 3-year contract with Century Linen and Uniform, Inc. This contract, as you will note, will commence July 19, 2019. The reason why is our original company that we had a contract with, Claris Linen, went bankrupt. During the reorganization stage, they felt that they couldn't continue to do business. our purchasing department went out to the marketplace and tried to get a company under an emergency situation, because we had 2 weeks to find a new linen company, and the only company that could be found was Century Linen, who took on this account on an emergency basis. Century Linen, should be noted, is also a NYSIT contracted company, which does not require an RFP. We could contract with NYSIT and therefore use Century Linen. As it turned out, the NYSIT contract was more money than we were paying Century Linen. So what we were able to do, because they were technically the low bidder, is that we worked with Century Linen and renegotiated the price below the NYSIT price. And this is the agreement that we were able to enter into for a 3-year period, no increase, at a not-to-exceed amount of $330,000 a year for linen rentals. That price, it should be noted, is approximately $50,000 more a year than we're paying now. But right now, we're averaging around 190 residents a day. This price is estimated at the 250 capacity that we have.
Am I hearing this is $1 million agreement?
It's a 3-year, $990,000 agreement. $330,000 a year, yes.
And we couldn't take and do it ourselves again?
Well, it cost us probably 50% more than this to do it ourselves, utilizing 2 shifts of staff, 7 days a week, all, civil servants, meaning collecting our benefit package, buying linen, running the machines, replacing the machines. Doing it ourselves is probably, I would say, double.
Okay.
When did we start doing it, do you recall?
Probably around 9 months after I started. So that would be the latter part of 2014.
That's not the first thing you asked, right?
It was the first thing that I did, actually, close the linen service. The washing machines and dryers were outdated. They were 30 years old. We had 2 shifts of staff, 7 days a week. They weren't really efficient in getting the job done. Bringing the linen over in the winter, this is much more, we probably saved around 40% of the expenditure.
One.
All right, thank you. So now this, I noticed it just says it's for sheets, pillowcases, and linen,
And mops.
and mops, okay? So how do the residents keep their clothes clean?
That is another contract which I will present tonight. That's Plaza Linen. Plaza Linen does resident clothing, 2 separate companies. One is resident clothing, specific to residents, and the other is Linen Rentals, which deals with blankets, sheets, pillowcases, drawer sheets.
So now, did I see here that this also says rental? Linen, so we're renting, we're renting the
It's
linen?
called Linen Rentals. We pay a per pound charge for all clean linen. We don't pay dirty linen because it's wet and dirty. We pay only on clean linen return by the pound. And it's called a rental service. Why? Because we don't want to buy linen. We have a loss protection within the contract, so we do not pay for losses, and we don't purchase linen. It's all purchased by Century Linen.
So, can you tell me how often this is, the service is provided? Is it once a week? Is it every 3 days? How does it work?
They are there 6 days a week.
Oh, they are there?
Pick
So-
up and deliver 6 days a week.
So they deliver 6 days a week?
And pick up 6 days a week.
Okay, so they deliver and pick up 6 days a week. So there's no equipment in the nursing home? No washers, no dryers?
No, no. All we do is bring in the linen, put it in a clean linen room. The linen goes up into decentralized areas of the nursing units on carts that the staff utilize to change the bed linens. We then collect the dirty linen as appropriate and bag them. They go down to a holding area, and once a day, traditionally in the morning, we're going to get a clean linen delivery, and then they pick up the soiled linen.
Okay, so are these our employees, or since you say they're there 6 days, they're picking up the linen from, is it our employees that's taking care of this, or how's it work?
Our staff are responsible for everything that happens internally, meaning we collect the linen, that's the certified nursing assistant's responsibility. The linen is brought down by environmental staff members and brought in by the same staff members. So those staff members bring in the linen, stack it, also responsible to bring it to the units. CNAs are responsible to change the linens, bag the linens, and then the housekeeping staff bring down the linen. And then when the truck comes in the morning, they will, there is these big carts that linen goes into. The linen company will take those carts and put them on their truck after they bring in the clean linen.
So the CNAs are responsible for,
We don't load the truck or unload the
that's
truck.
all we don't do is load the truck.
That's correct. We do everything else but unload or load the truck. And of course, we don't clean the linen. That's done at their premises.
Thank you. Any other questions? Is there a motion?
Motion.
A second? All in favor? Aye. That motion carries. Thank you. Next is the agreement with Clinical Staffing Resources.
Okay, Clinical Staffing Resources is one of our staffing companies. Approximately 4 or 5 months ago, we entered into an emergency agreement, even though we happen to have had a standing agreement with Clinical Staffing. We entered into an emergency staffing agreement with 4 different companies. Then we didn't have to, but because we were working under an emergency agreement with staffing companies due to the situation at the nursing home finding appropriate levels of staff, we went out and did an RFP during that emergency period. The emergency contracts were approved at CAB. We were required to go out and do an RFP to get out of the emergency situation in those short-term contracts. The 2 bidders that bid on that contract, one of which is this company, Clinical Staffing Resources. The second is the next contract, which I'll get into, is Horizon Healthcare. Because we could no longer continue under the emergency agreement, we had to enter into a long-term agreement with those that answered the RFP. One of those companies is Clinical Staffing, and we put it in for $100,000 a year for a 3-year period. It is our belief, and I discussed this at my budget meeting, that it is our hope, knowing how many staff members we were able to hire over the last 4 weeks, plus those that are already in the hopper to be retained and hired at the nursing home. It is our hope that by the first of the year, we won't be using any agencies, even though this contract will be in place.
So, yes, so what's the period for this,
This is a 36-month agreement, 3 years. That's how the RFP was written.
starting when?
Excuse me?
Starting when?
It'll start when it's approved. Right now, we're under an emergency contract approved by CAB, short-term, and when this is approved and then goes to the full-fledged next month, it will go to our legal department. They will issue the contract. I'm assuming it'll have a start date somewhere around November 1st or December 1st.
So, is it my understanding that we've hired 35 people?
We have hired 35 people since around 30 days ago. That is correct. Some are already on staff, and some are, actually, we had 9 people show up this morning for orientation.
And so how many of those 35 people were CNAs?
Out of the 35, approximately 22.
22. And so, and this is for temporary staffing, you said
This contract is for certified nursing assistants only and temporary staffing only, when needed. Our staff is always utilized first. That would be overtime, or really we start with per diem, and then for per diem, we use part-time. And if those two cannot be found to work shifts, because that's at straight time, we then will seek overtime from our own staff. And if those three sources do not produce the staffing pattern that we need, we then would utilize agency staff.
So, let me just ask this question so I get it straight in my head. So we're authorizing a contract for $100,000 a year for CNAs, which may not be available, because we have not hired them. But I thought we were looking to how many CNAs are we down right now, since we hired at least 22?
Right now, we have 10 openings on the day shift. We have 8 openings on evenings and none on nights. So days is considered 7 a.m., 3 p.m., evenings 3 p.m. to 11 p.m., and then nights 11 p.m. to 7 a.m. We have no openings whatsoever on nights. We have a few part-time positions on evenings and days, and total openings for days and evenings is approximately 16 positions. But that's based on a census of 250. Right now, our census today was 190.
So now, with the overtime that we allot for people to work, how does this interact with that? This $100,000 that you're asking for to pay CNAs?
Well, this is the last in the order of how we retain staff. The first is per diem. The second is part-time, both of which are not overtime. The third is utilizing our staff at an overtime rate, which is time and a half. And then the fourth, when we can't find those three to fill vacant positions, it would be using an agency. I believe now, with the retention of the people we hired over the last 30 days, it is our hope, and this was presented at the budget meeting, that this agency contract will not be utilized.
So we use it as we go?
Correct. That is correct. It's a not to exceed amount. It's there. It's in our budget, but we hope not to utilize any of these dollars, especially if we continue to retain the staff and hire the staff that we've been able to over the last 30 days.
Thank you.
What's the starting salary in
On the contract or ours? Our contract now is $27,315 a year, which comes out to approximately $15 an hour. That's our starting salary. However, under the new contract that we signed, we are allowed to pay up to $33,000 a year if someone has 21 plus years experience from another nursing home or in their career and it's justified. That salary is in excess of around $18 an hour.
Okay,
Is
thank
that
you.
proper utilization?
Oh, we're in the ballpark now. That's why I believe we're getting the people coming to our door, filling out applications.
For the years, yeah.
Because it's out on the street now. We're advertising, it's at bus stations, it's on the radio, and it's having a really, really positive effect on not only our hiring, but retention.
That's a problem through the years. That's been our problem through the years.
Correct. We are now, our lowest salary, $27,315, which is $15 an hour, is the median for Albany. So our lowest salary is the middle.
Good. Good start.
Thank you. Is there a motion?
Motion.
Motion and a second. All in favor? Aye. That motion carries. Thank you. So we're on to Horizon Healthcare.
So Horizon Healthcare is identical to clinical staffing. It's the same exact contract. It's run off the same RFP. It's one of the companies that bid on being our agency, and they were within the ballpark of the hourly rate that we were willing to pay.
Thank you. Any questions? Is there a motion? Motion and a second. All in favor? Aye. That motion carries. Thank you. Celtic Consulting.
Okay, Celtic Consulting is our minimum data set, MDS consulting company, who works with our registered nurses and our clinical staff on completing the MDS, which I said is called minimum data set. That is how the nursing home gets reimbursed. This contract used to be under another company. We received, we did an RFP last year and chose Celtic Consulting as the new company. This is a renewal of their existing agreement for January 1, 2020 through December 31, 2020 at the same rate that we're paying this year. And again, they consult all of our therapists, PT, OT, physical therapy, occupational therapy, speech therapy, all the nursing staff, dietitians, social workers, anyone that deals with the resident on a clinical level and responsible for the minimum data set, which gives us our case mix, which gives us our reimbursement.
Thank you. Questions? Motion? Motion and second. All in favor? I think I got it. That carries. Plaza Linen, Mr. Slatke, you already explained that. I'm sorry?
Is this about the resident?
Yes.
Okay, I got questions on this. This is different from the other one.
Okay.
All right, you want me, this is Plaza Linen. This
Right, I
is, I
understand.
mentioned, this is the one that does resident clothing.
Can you tell me how they track the, maintaining whose clothes are, picked up to ensuring that they're delivered back to the right person?
Right, the current system that we have now is every resident's clothing should be labeled. So there's a lot of processes in place that require family members that bring in new clothing or any clothing, that they bring it to social work first, social worker brings it to our laundry service, that's internal laundry service, and we label all the clothing with the resident's name. When the resident wears clothing, if we're doing the clothing, sometimes families pick up the clothing, but if we're doing the clothing is collected when soiled by the certified nursing assistant or any staff member caring for the resident, is put into a barrel, resident clothing barrel, that's different than the linen barrel, and it's taken out by unit, okay, not resident specific, but by unit for everyone living on that floor, by resident name and unit. It comes back the same way on hangers. If everyone's clothing is labeled, it's going to come back to them, to the unit, and then the staff members bring it back to the resident room and hang it in their closets.
Do you get any complaints for any of the from the residents?
What?
Do you get any complaints from the residents?
Yes.
Yeah.
It's a very difficult process to follow with so much clothing going back and forth. Residents also don't always label, meaning families don't always give us the clothing, so not everything is labeled. It's very difficult to keep track of 200 people's clothing every single day, and it's a process that we work on. I just actually had a meeting last week with the person in charge of that service internally, where I've never really been in a nursing home that didn't have a container in the room that was specific to the resident. And then when they brought the resident clothing to the laundry, it was in a bag labeled for that particular resident and went out that way, came back that way. This nursing home has a system where they collect everything by unit versus by resident. We're now looking into actually collecting the clothing by resident and then sending it out by resident and bringing it back by resident and seeing if that is actually a better process. With the new nursing home and the space that we'll have, we'll be able to really have containers will fit into a room and collect resident clothing. Under the current situation, it's really hard to have an additional container in the room, but under our new nursing home square footage, we would be able to do that. So we're looking into that as we speak.
I appreciate you addressing that. Thank you.
Yes.
Motion.
There's a motion, is there a second? Second, all in favor? Aye. That motion carries, thank you. Core Tactics.
Take my jacket. Core Tactics is one of our consulting companies for the nursing department and clinicians. They deal with what's called the quality measures, which is the direct relationship to our reimbursement system and our 5-star rating. Even though you don't receive this data, we were notified last week, late last week, that we finally went to a 5-star quality nursing home. That means our quality measures, which is the highest star rating you could get, is 5 stars. And unfortunately, because it takes 3 years to change a survey star, we're still a 1 star on the survey. And there's a lot of reasons for that, but we're still 1 star. However, our overall rating, okay, went from 1 star to 2 star, okay, which for us, I don't want to say that it's a 100% increase, but it's a 100% increase because we went from 1 to 2. But the fact of the matter is, that's, in our business, it's huge, that we're able to go overall quality up 1 star in overall rating, but we're now known as a 5-star quality nursing home. And if we could ever change, which hopefully the next survey will do this for us, that survey rating from 1 to 2 or 3 stars will eventually jump to a 4-star overall nursing home rating. Core Tactics is the company that works with us day in and day out on that particular clinical outcomes for quality. And they're really instrumental in assisting us. And we don't just get a worker there. The owner of the company is our representative, and she's there every week. And she really does a phenomenal job. She also helped us with the bronze rating that we now have with the American Healthcare Association, and we're now working on the silver rating, which hopefully we'll be submitting next year.
Thank you. Question?
I just want to say one thing. Having gone through this process and talked about Core Tactics before and the different ratings that the nursing home has to undergo, I want to congratulate you on the job that you've done, because I know all of the different things that you've explained that the nursing home has to meet.
Right.
And how you've always been forthcoming on, why we didn't meet certain things. And so I just want to congratulate you on moving from, as you said, 50% 1 to 2.
Thank you very much.
Thank you.
Thank you.
Is there a motion?
Motion.
Motion and a second. All in favor?
Should have done that a long time ago.
That motion carries. And finally,
My last one.
the agreement with the New York State Health Facilities Association.
Yep. New York State Health Facilities Association happens to be our association. And we were fortunate enough to be notified approximately 2 weeks ago that we have qualified for what's called the Advanced Training Initiative. And that deals with staff retention and recruitment over the last year. And that approval comes with a check. Actually, I can't believe that we got it already, because they're normally not that quick in giving us the revenue from that program. Last week, we got a check for $433,000 for retention and recruitment. One of the requirements of that program is to retain an association, and we used our own association because it makes sense to use our own people, and to enter into this agreement, which is 2 years. That money represents 2 years that will be spent on recruitment and retention. And any way we choose to use it, we can use it, by the way. And this will be around $60,000 per year for education based on the program created by the New York State Department of Health for the Advanced Training Initiative, which they created. So we're going to be using $120,000 of the $433,000 that's already in the bank over 2 years to pay for the educational portion of the Advanced Training Initiative.
Thank you. Questions? Motion? And a second, all in favor? Aye. That motion carries. Thank you, Mr. Flaxman.
Okay, thank you.
And a second, all in favor? Thank you all very much.